hold on. Just give me 2 minutes at the end. I'll start this. Aloha. My name is Roger Jelinek. I'm Executive Director of the Hawaii Book and Music Festival. And it's my great pleasure to welcome attendees and to welcome this very distinguished panel on a topic of extraordinary current interest. There seem to be stories about it in the media almost every day. It's obviously a phenomenon that was exacerbated by the epidemic. And these are particularly articulate and experienced participants on the therapeutic side. So without further ado, I'm going to turn this over to your moderator, Maya Sotoro Ing, and I will disappear, but I'll be around. Mahalo.
Mahalo, Roger. Thank you so much for your continued leadership at the Hawaii Book and Music Festival, offering all of these important, meaningful, and entertaining conversations for our community. I would like to just briefly offer up a land acknowledgement, acknowledging Hawaii as an indigenous space whose original people, the Kanaka Maoli, have shaped knowledge systems and a reality that is sustainable, that allows us all to enjoy her gifts today. And for this, we are truly grateful. I am exceedingly interested in today's topic. I come to it with no particular experience or keen insight, but I do have a lot of experience as a teacher and have been able to work with teenagers and find that the problems of today are not unlike those that I experienced a number of years ago. I work now at the Matsunaga Institute for Peace and Conflict Resolution with the Girls Opportunity Alliance and the Leaders Asia Pacific. So I don't work with children and teenagers anymore, but I'd be interested to know today if things have in fact changed. And today's esteemed panelists have enormous insight about the journey of childhood and teen anxiety disorders and of our community in recent years. So good that we get some updated information. Even before the COVID-19 pandemic, growing numbers of young people were clearly experiencing high rates of clinical level anxiety. As we open up this conversation, it's important that we, of course, acknowledge the added stressors like social isolation, missed milestones, and increased family tension, and background stressors such as school shootings, political unrest, and the war in Ukraine in the United States. And but we also need to think about, our culture and our solutions, and have a strength-based approach to explore the curability, perhaps, of childhood anxiety, or at least a reduction in the epidemic proportions. Whether we're parents, educators, community members, all of us have to commit to supporting young people through their worries and fears, which threaten to take away courage, safety, health, and initiative. So we've seen way too many talented and beautiful young people with a distorted sense of self, feelings of failure, disillusionment, despair, young people with persistent negative thoughts. And I have to be honest, my own daughter struggled for a time, and Dr. Coffey was helpful. I used meditation with her as well, and deep breathing and art therapy. And I know that culturally responsive strategies can help with the frenzied pace and unpredictability of this time, the community violence. But I really want to know more about what we can do to address early childhood trauma, social isolation, and these other factors. So first, I'd like to introduce our esteemed panelists. We have Alana Wade Coffey, who's a licensed psychologist in private practice and the co-founder of the Honolulu Psychology Collective, LLC, which is a mental health group practice. Dr. Coffey earned her PhD in educational psychology in 2004 and her respecialization certificate in clinical psychology in 2012 from Manoa. Since 1995, Dr. Coffey has worked in public and private education, community mental health, Kaiser Permanente, and private practice, serving adolescents, adults, couples, parents, and our beloved community. She has written curricula and provided professional training on domestic violence treatment, the effects of domestic violence on children, teaching anger management and communication skills to youth, and co-parenting skills for parents in high conflict involvement, court involvements. Next, we have Dr. Anthony P. Guerrero, or Dr. Tony, as he wishes to be called, who is a professor and chair of psychiatry and clinical professor of pediatrics at the University of Hawaii, John Burns Medical School of Medicine, where he completed his school and residency training in general pediatrics, general psychiatry, and child and adolescent psychiatry. He also serves at present as chief of psychiatry at the Queen's Medical Center and formerly served as medical executive committee representative for psychiatry at Kapiolani Medical Center for Women and Children. And then finally, we have Dr. Chayanin Jing Phungsathaporn. Dr. Jing received her medical degree from Chulalongkorn University, Faculty of Medicine in Thailand. She attended residency at the University of Hawaii at Manoa John Burns School of Medicine and completed her child and adolescent fellowship at Tufts Medical Center and Tufts Children's Hospital. Dr. Jing is board certified in psychiatry and board eligible in child and adolescent psychiatry. Her clinical interests are family therapy, psychodynamic psychotherapy, infant mental health, LGBTQ plus, gender affirming care, anxiety disorder, and psychogenic non-epileptic seizures. Her research interests at this time include curriculum development and family therapy teaching. She has also participated in research on cyberbullying. Okay, so a lot of interests and expertise covered with these three. First, I would like for each of you, please, to offer us a bit of context, perhaps starting with you, Dr. Coffey. You know, what is the current landscape of childhood and teen anxiety disorders? How did we get here? And help us to understand, perhaps the effects of COVID, but also those conditions that preceded it.
All right. So, Colin, if I could have my 3 slides. Thank you so much, Maya. So first, let me answer this just from the perspective of the seat that I'm sitting in right now as a clinician and as someone who is part of this group practice. The first 3, Colin, if I may ask you to start it from the beginning. Thank you. In our group practice, there's collectively about 15 of us clinicians. And when I was invited to do this, I'm like, okay, I know that there's going to be, other smart panelists are going to bring some stats, but I just wanted to ask my group here, this is my little hui, what did you guys see in the last few years? And so next slide, please, Colin. My first question was, let's just do 4 years, some sort of discrete amount of time. What did you guys notice about children's anxiety? Simple question. Have you noticed if it increased? 85% of the people said yes, about 4 years ago, we started to notice it increasing. To me, it'd been increasing even before that, but again, I cut it off at only the 4 years. Next slide, please. And in the last 2 years, have you noticed it increasing? This is the next question I asked. And as you can see by these numbers, it's somewhat less. So what that tells me is that we noticed that anxiety was increasing before the onset of this pandemic for children. Now, this is not a scientific study by any means. It's just, what did we see in our group practice? And then finally, the third slide, I asked our clinicians, well, what about the adults who have children? What are they bringing in their practice? And as you can see, only about 50% of the adults are talking about their child's anxiety. So if anxiety's like about 85% of the kids are reporting an increase in anxiety, but only 50% of the parents come to therapy and share their experiences with their child's anxiety. To me, that just kind of lets me know, the adults might be missing some of the child's anxiety. I'm Pau with the slides. Thank you, Colin. And that means that the children are out there trying to figure it out, sometimes alone, or they're going to sources that are not really credible. There's so many sources for the anxiety. I don't want to take up all the time with that, but their world has just gotten so much bigger. Now, I'm of the generation, I'm going to date myself, I'm a boomer. We had 3 TV channels. At midnight, the thing went off. My son was like, what is that fuzzy stuff in the movie Poltergeist? He didn't even know what that was, because they have 24/7 hundreds of channels. So their world, it's just constantly flooded. And if I could, I would just put Peaky Blinders on, well, the children and myself, because their field, the vision field is just so broad and wide and deep and incessant. So that's what we're seeing here at our practice. I'll let one of the other panelists also take that question.
Dr. Garo, I'm gonna ask for you to go first because I didn't prepare any slides. I'm hoping to join in as a panelist to kind of like answer some questions, so I didn't have any slide prepared.
Sure. Okay. Thank you, Dr. Coffey and Dr. Jing. Roger, do you think you might be able to help pull up the slides? Great. Thank you so much. So I did put together a few slides, and this is something that hopefully is on an overview level and a discussion stimulating level. And, I really appreciated Dr. Coffey's information about, the local experience with anxiety, depression, and other emotional conditions. So, I've identified myself not just in terms of my professional roles, but also in terms of my personal roles that have had impacts within the COVID-19 pandemic. And maybe the next slide. Because I'm so used to having to do these disclosures, I did the same thing for these slides as well. Next slide. Okay, I'm gonna, just refer to a few articles in the literature that talk a little bit about how the COVID-19 pandemic has seemed to affect the people of this world, starting with people in general and drilling down to kids and kids in specific situations. So, in a sort of pooling together of available studies, it seems that in the earlier part of the pandemic, there were a lot of emotional and behavioral symptoms that developed in people, ranging from post-trauma types of distress to fear, to anxiety, to depression. And, what I wanted to sort of point out is that, certain populations seem to be fairly vulnerable, like, caregivers and family members of people with COVID-19, healthcare workers, and other people in the general population. It did note that, females may have, more vulnerability. Younger people may have more vulnerability. The ways that adults and people other than adults manifested stress maybe a little bit different. And, the types of things that we're seeing also vary based on the income level of the country that you live in. Next slide, please. If we drill things down to youth, if you look at studies ranging from 2020 to 2021, it seems like, globally, about 1 in 4 youth are experiencing clinically elevated depression, and 1 in 5 youth are experiencing clinically elevated anxiety. And, how does this compare to what it was before the pandemic? It looks like it's about double of what it was pre-pandemic. Next slide, please. And if you look at the experiences of, there we go. If you look at the experiences of, go back one more slide. If you look at the experiences of kids presenting in emergency settings, it looks like the experience is that there's more distress that leads to kids needing to present in emergency types of situations. And, some of this had to do with reduced access to treatment in the community. So, when you combine the pandemic itself with the pandemic's effect on the degree of access, then you might have, more levels of distress that lead to emergencies. And, it does seem like there's disparities in how the pandemic has affected people. This is from a study in the US, and different populations are affected in different ways in terms of rates of suicide ideation. And, if you look at the pediatric subset, there's been effects that vary by, by population and ethnic identification demographics. So next slide, please. I think, in order to understand, how to help kids, I think it's worthwhile thinking a little bit about what are the mechanisms by which kids are affected by the pandemic, or any of the types of stresses that Maya identified earlier that we all may be facing in the world. So, if you are directly experiencing the illness, there's all sorts of ways that the illness can physiologically affect you. And there's also the psychological impact of having the illness. So, at least earlier in the pandemic, there was a lot of literature about how with the COVID-19 infection, you could have, brain effects, in addition to the trauma of, the illness, as well as the adjustment to the illness. If you're a family member, you may be living with fear, uncertainty. If there's death that's associated, there could be bereavement and separation. So these are some of the direct impacts. And, if you keep scrolling to the next slide, I think it's worthwhile putting this in the context of development. So, kids have different stages of life, and adults have different stages of life where, your social development meets certain milestones, your cognitive, how you think and how you process things goes through certain development. And, just for reference, I also, tried to correlate with what has been published about, generational stages in Hawaiian culture. You can sort of tell how, a kid who has a need to be separated from their parents because of parents' illness can deal with it differently, whether they're 3 years old and, facing a lot of baseline anxiety about separation versus, 11 to 20 years old. If you move to the next slide and you think about adult development, and the sort of things that adults need, at certain stages of our lives, we need, more intimacy and relationship building. And in other stages of life, we need to sort of feel like we're generative. If you look at the way a pandemic disrupts all of this, it can be really exquisitely disruptive, at stages of life where you're really, needing to be more social and more connected with people. So just keep these things in mind when you think about all the ways that the pandemic impacts us, and think about how the pandemic can uniquely affect youth who are supposed to be getting more connected with school, more connected with peers, more responsible, discovering the world, things like that. So next slide, please. So, these are just pictures of things that were faced by many people in the midst of the pandemic. And so far, I'm talking more about the direct effects of the pandemic, the illness itself and the loss that may have been the result. Next slide, please. We all know that there were a lot of other minor disruptions, quote, minor disruptions about the pandemic, in terms of schedules, in terms of routines. And I don't know if any of you remember that very early in the pandemic, we didn't even know where our toilet paper was coming from. I mean, there's a lot of humor and, joking about it, but, this is another thing that can contribute to, a diminished sense of well-being. So next slide, please. So there's a lot of indirect impacts, and this is not an exhaustive list, but you can just read through this. I mean, there's anxiety, there's unemployment, there's financial stress, there's disruptions of schedule, there's separations related to distancing and quarantine. Your spiritual community may be disrupted. There were rates that increased of domestic violence, because you're kind of locked in, in the house. There's more media exposure to trauma, and there can be disruptions in dating, long-term commitments, and family planning. Next slide, please. So, when we talk about anxiety, anxiety is one among a list of many other, psychiatric behavioral health conditions. And, it's generally one of the conditions that, is made worse often by the direct and indirect effects that have just been described. But nearly any of the conditions that we as behavioral health providers treat because of these direct and indirect effects could have gotten, worse in the context of the pandemic. Rarely there were situations where the situation of the pandemic improved some people's ability to function. But, if you look at all the ways that the pandemic affects us, you can look at people who may already have these conditions and see all the ways that they could be more vulnerable. And I've also bolded the types of disorders that might be direct effects of the pandemic itself, including the neurocognitive disorders. So next slide, please. Okay, and as Maya suggested, there's a lot of other things besides just the pandemic that kids are needing to worry about these days. Ranging from pandemics, climate change, inequalities, and disparities and injustices. And this is probably a slide that could take us off in another 30-minute tangent, but suffice it to say, I think the solutions to the effects of the pandemic, interestingly enough, could actually help with a lot of the other things that we're all trying to face. I mean, if you take better care of the environment, and you think about the impact of what you do with the global community, you're probably more likely to prevent a lot of the things that lead to pandemics. And if you look at how to best address inequalities, you're probably likely going to improve the health of nearly everyone, not just those affected by inequalities. Next slide, please. So, in terms of other things that we can do, you may hear about a shortage of behavioral health providers, and it probably became even more obvious in the midst of the pandemic when there was higher need and decreased access. A lot of us ended up doing telemedicine during the pandemic because it reduced the person-to-person contact. And, we found that this is probably something that we should be doing more of to improve people's access to care. But we also realized that, even with telemedicine, there still is a shortage. I mean, it improves the degree to which someone in a remote area can find care, but it doesn't necessarily address, the overall limited supply of providers relative to the need. So what we're finding is that, collaborations with primary care providers, collaborations with, every other professional that touches a kid is going to be really important. And the next slide also shows a little bit of this principle in more detail. Sorry, I didn't realize that this slide goes step by step. So maybe just keep pressing your next button. So, what this is showing is that there's usually a cascade of events that leads to, adverse mental health outcomes in kids and adolescents. And there's many ways that you can probably intervene with all of these pathways coming to fruition. So, other communities, other governments have really looked at how do you make mental health care access routine for all kids, the way dental care, the way eye care, the way primary care is, routine for all kids. Because if you look at all the ways where you can intervene, I mean, there may be places to put in practices like mindfulness, family strengthening, conflict resolution, so that you don't quite get to these points. So next slide. The only way to do this is if you, really view all of this as teamwork, so that, not just specialists with the training in psychiatry or clinical psychology or other fields, but, you really need everyone else who touches a kid's life to all work together and, sort of generalize the expertise so that, you'll have enough people to support kids' mental health. So next slide, please. And yeah, those are the main things I wanted to highlight. These are my contact numbers and emails, and I really hope for peace and wellness for everyone. Yeah, thank you. Maybe now we could go to Dr. Jing.
Thank you very much, Dr. Girl. That was beautiful slides. And the reason why I let you go first is so that I can piggyback my points to your slide, because you explained, how each person developmental trajectory is, and each age group has their own, strengths and challenges and stuff like that. So our focus of today is anxiety in children and adolescents, and particularly how it kind of like evolved after COVID. So the way I look at anxiety is that everyone has anxiety, right? Because anxiety is somewhat the thing that keep us, who we are and keep us from getting in trouble. So normal anxiety might be if you have anxiety about school performance and you study so that you get better grades. If you have anxiety about getting infected COVID during the pandemic, you wash your hands and you wear a mask, and that's will protect you from getting COVID. So those are normal anxiety. But if the anxiety is too much, in terms of like, I look at anxiety as like an alarm. So let's say there's fire, the alarm will go off. But if the fire alarm kind of make the false alarm and it like keep ringing when there's no fire, that's like the anxiety that the body is like signaling when there's no like true dangers or there's nothing to worry about, but we just keep having anxiety. If it's too much or if it's too long, like instead of like, just anxiety about school and then during the school break or the weekend, then kids are fine, then it should be okay. But if it's too long all the time and too intense, like instead of just like small anxiety, the kids are so intense to the point that it affects their sleep, it affects their eating, it affects their school performance, it affects their peer interaction, then we have to look at anxiety disorder. And Dr. Girl kind of showed there's like different types, and that's when the kids go see the professionals and kind of determine what type it is, and then they get treatment, either therapy and or medication. And certainly COVID pandemic kind of make it add layers to it, I would say, because of the uncertainty about COVID pandemic in terms of like the kids, back 2 years ago when the school shut down, the kids didn't know when they're gonna see their friends again. The kids didn't know when they're gonna go back to the classroom instead of doing the online learning again. And we, can have another talk about how online learning, affect kids' learning and mental health and stuff like that. So the uncertainty probably make the anxiety worse or even prolong. And the COVID pandemic also make people more isolated because of the social distancing, and it caused like separation, whether through death or unable to visit the family who lives in another place and things like that. So typically, if we look at ourselves when we take care of our own mental health or wellness, what do? We like eat good food or like talk with family who make us feel better, or Dr. Coffee talk about, the TV, which in the past it's only go into certain times, and do a lot of things that we enjoy. But the COVID pandemic kind of stopped us from doing that. So, with the intensity of the COVID pandemic and with how it disrupt our life, and with us not able to access the health and wellness activities that we used to do, it just like caused things even worse. So that's the way I look in terms of the anxiety. Is it normal or is it disorder? And what do we do about it? I'm glad we have this forum for us to talk to the general population, for everyone to be more aware. And if you see signs in yourself or the loved ones, then you can kind of start to get help. I'm gonna head back to Maya for the next question.
Thank you all so much for that very comprehensive, overview. And each of you shared a different perspective, all useful. I would love you started to mention some of the, solutions or ideas. Obviously, a key component of our solutionary thinking has to be that multifaceted teamwork that you spoke about, Dr. Tony, but this notion that we have to triangulate our responses and ensure that we are collaborating in good communication with one another. I would love to have you also share, in addition to that communication for maintaining stability, understanding, information, and so forth, what are some other best practices that you all have seen in Hawaii for dealing with childhood and teenage anxiety disorder specifically, as well as some effective practices perhaps that you have observed or studied or heard about nationally and globally? And just anybody jump in here.
I'll take this one just because I want to just highlight the role of anger. Everyone's anxiety manifests differently. It presents differently. And when I was a high school teacher is when this really came visible to me, is that children often act out when they're anxious, like they simply misbehave. And the practice of scolding them or being very punitive, or worse, giving them lickings or dirty lickings, is counterproductive, because what that child actually needs is reassurance, information, clarification. They don't need an audience. They maybe need some isolation so that they can de-escalate and calm themselves down. But what I see too often, unfortunately, is anger has a way of being met with other anger. So if we could collectively, not just therapists, but we as parents and teachers and people in the community, we see someone being angry, in particular a child, that's somebody that's scared and kind of lost control of themselves. We can maybe give them an opportunity to reclaim some of their own personal power and calm themselves down before we take the fight to them, because that has a tendency to escalate things, unfortunately, out of control. And I do believe that's part of what happened in the continental US with, so many conflicts ending in young people, unfortunately, dying, is because they were not met with very therapeutic or understanding powerful authority folks.
Thank you, Dr. Jing, Dr. Tony. Would either of you like to add to that?
Yeah, thanks. I think that's an excellent point. I mean, really looking at what the different components of distress that lead to anxiety. I think if we look at the evidence, I think there are certain psychotherapies that are effective for many of the anxiety disorders in kids, that take a sort of cognitive and behavioral approach where you look at the situations, the thoughts that automatically come to you in these situations, and then the emotions that come from these automatic thoughts that then lead to the behaviors. I mean, if you sort of understand that, then you can figure out ways to stop the cycle of things that leads to anxiety. And I think that when you approach anxiety and psychotherapy, it's helpful for people to realize that anxiety has a bit of an adaptive component as well. I mean, anxiety exists in our brains so that we can survive. I mean, if none of us had any anxiety in our system, then, we wouldn't run away from a hungry snake or a hungry predator. But, I think what is important for people to learn is that anxiety becomes a problem when it no longer is helping you to survive better. If there's no way to turn off the on button that, you have for anxiety. So that's where, specific techniques, practicing this examination of your automatic thoughts, practicing behaviors that sort of turn off this, this switch in your body, like, deep breathing, progressive muscle relaxation, mindfulness. I mean, these are ways that, your body can be trained to better manage anxiety. And, it's a little bit like a muscle. I mean, you have to exercise it and flex it and use it in multiple situations so that, your ability to manage anxiety can improve. And there is a role of medications as well, because medications are another way to, help with this automatic on switch for anxiety. And I think if you look at all the things that lead to anxiety directly and indirectly, I mean, helping the family, helping the ecosystem around the child or adolescent, I think is, an important piece of this too. So yeah, let me stop there. Thank you.
Yeah, I'm glad Dr. Girl brought up the mindfulness and the psychotherapy, because when Maya asked the questions about best practices to deal with childhood anxiety disorder, the first keyword that came to mind was emotional regulation. And the emotional regulation skills is probably something that will be like a lifelong learning for everyone. But if kids get to kind of practice those skills at early age, then they'll be able to see that, oh, the anxiety that they see is just a signal for something, and how do they deal with it is like a different story. They can act out on it, like Dr. Coffey mentioning. If they don't have enough emotional regulation skills, then they will probably act out on it, or some kids cut to kind of deal with that distress, or they can problem solve effectively, and seeing the intention of each emotion is very delicate. Like, you can't just like learn how to do it and just do it instantly. It's like a muscle that you have to build. Like the movie Inside Out, which is why I have the character here. And I heard they have like Inside Out #2 coming out next year, and I'm very happy because that movie is such a good example of telling us that we all have these emotions, and it's okay. It's okay to get angry. It's okay to get anxious. It's okay to get sad. But what do we do with it when we have those emotions? That's what important. And parents have to be role model too, because if parents, like scold the kids or act out on their anxiety or anger, then the kid's not going to learn how to calm themselves down. And I want to talk about the role of the medication a little bit, because I'm an inpatient child psychiatrist. So most of the time, kids who come to be admitted in the hospital are usually go through therapy already, or having some kind of support already. And sometimes just therapy alone may not be able to manage the anxiety, so we have to add the medication for it. And the anti-anxiety medication, typically the first line for kids is we're going to use SSRI. We might have heard of that term before, serotonin selective reuptake inhibitor, which is the medication in the class that can help regulate the neurotransmitter in the brain called serotonin, that kind of help the intensity of the anxiety kind of less. It's not going to get away the anxiety, we're not going to have zero anxiety because we know that anxiety is somewhat adaptive and we have it somehow, but it's going to help lessen the intensity of the anxiety. It's going to help the body reaction. Like sometimes someone have panic attack, they might feel like their heart is racing really fast, or they have headaches, or their muscle is shaking. So those physical symptoms will be less with the medication. And they might notice themselves being able to tolerate frustration a little bit more. So those are the benefit of medication for anxiety. There are also some risks as well in terms of the side effect, and all medication has side effect. There's like pros and cons to everything. This medication has been studied for more than decades, and it shows the efficacy and the side effect profile is pretty mild. I'm not going to talk about side effect in detail because each medication has their own side effect, and it's best to talk to the doctors when your child or when yourself are going to start the medication. But generally, the more common one are headaches, stomach aches would usually go away. There's some serious side effect too, but it also depends on what medication you're taking. If you have any comorbidity, like if you have like medical condition that you take other medication with this medication or not. And Dr. Guru, do you have anything to add about the medication for anxiety?
And no, I don't think so. I mean, I think you covered it pretty well. You spoke about its role, particularly in treatment of kids who are at the level where they need inpatient hospitalization. And, I think to brag about my colleague a little bit, Dr. Jing works in a very important place, which is, a child and adolescent inpatient unit. And, currently there are only 2 child and adolescent inpatient units for kids in the entire state. And, these are the places that really provide a lot of healing where healing may be necessary. It's an important safety net for the community. And, they work closely with the emergency departments throughout the state. And yeah, thank you.
Yeah, thank you very much. And thank you for giving us insight into that, very specific world of interventions. Now, one thing that you've made abundantly clear is that there are healthy levels of anxiety. Anxiety is, in fact, a natural response. It's protective. And it actually aids us in being less vulnerable at times to because of a sort of a helpful vigilance, right? And that sort of thing. One of the things that Dr. Coffey mentioned earlier in terms of, especially on the continent, but not exclusively, a lot of young people being victim to violence because they did not have community sourced solutions of wraparound protections. They weren't listened to, they weren't heard, they weren't understood, and that sort of thing. So I want to take a moment now and just kind of think of it in terms of the community level, right? In terms of the anxiety, the communal anxiety that folks are experiencing. And I want to ask you about culturally responsive techniques that might be helpful. I know that lately I've been learning a lot more about embodied social justice, for instance, and about the need to heal both the personal body and the community body as we work towards greater social justice and, in the presence of inequality. I would love for you folks to speak to, are there Hawaiian, are there Kanaka or other culturally responsive techniques that might alleviate youth anxiety here? Or, looking more broadly, are there cultures and communities that offer some answer that we should be paying attention to, so that you can have those sort of community wraparounds and broader support and ground young people in a sense of identity that allows them to set down some of their worries. Dr. Coffey, perhaps would you speak to that, since the question emerges kind of from your comments? If you would speak to that first.
I by no means have the answer because that's such a broad concept. For example, I grew up here in Hawaii, visibly African American. In the last 2.5 years, there's been an increase of people in Hawaii who are also African American seeking therapists who are African American. Their assumption is that if I get to a Black therapist, some of the small talk can be expedited and I can just get straight into the issue that concerns me. And some of the children are saying they don't feel safe or heard or things like that, or they might bring it up with one of their other teachers or therapists, and that person is either visibly uncomfortable or doesn't really know how to respond, understandably so, because it's not necessarily a shared experience. But then I also don't represent the whole diaspora of Black people. I mean, there's a broad thing. Now, I'm thinking if this is happening within the Black community, it's also happening within possibly Asian communities. It's happening with other Indigenous communities, even happening with European communities in this country, where people are just wanting familiarity and connectivity and not wanting to feel so alone, because I think there's a lot of loneliness that's happening and a lot of people feeling maligned or not understood. So by no means is my whole practice full of Black children. We're only 3% of the population. So when I do have other folks come through, I want to be very mindful. I'm asking them, what culture are you identifying with? What gender are you identifying with? And then I will inform myself as much as possible where they are and try to meet them there. I'm not perfect with it. I make mistakes all the time, but at least I'm trying to be present for whatever it is that they're saying they need. And some of that is very social, cultural, not just emotional.
Thank you. And Dr. Tony, Dr. Jing, would either of you like to add anything to that?
Yeah, I think that's very well said. And I also am not, an expert in the indigenous approaches that may be particularly helpful. But I do think that there is definitely a lot of indigenous wisdom out there that we really need to be learning about, and that we can probably make more accessible to our patients if we work through communities, if we work through people other than ourselves who are trusted by patients and trusted by families. And that's why I think, multidisciplinary models are really important, where people can sort of tell us, what do you think may be most helpful? What do you think is available out there that could be helpful? And, help me see this from, the point of view that you may be having right now. And, what do you think, should be the next steps? I work primarily, I work primarily in an academic department where we teach medical students, we teach psychiatry residents. And, one of the things we teach is, family therapy. And, we usually approach it from the standpoint of, all of the more Western theories of psychology and personality, and, the family theories that evolved from that. But then, we realize that, we live in Hawaii, and, there's been indigenous conflict resolution and family healing in the form of Ho'oponopono that, we don't necessarily have at the foundation of all of our training. And, at our department, we're trying to change some of that. We're trying to, expose trainees early on to, just more diversity in how we approach kids and families. So, that's one example I can think of. So, yeah, thank you.
Thank you. Excellent responses. I appreciate very much your dual emphasis on kind of looking at the particular needs, for both of you, of of your clients, of those whom you serve, but also kind of taking a look at how we can all benefit from some of what is out there that is effective, that is respectful, that involves, sort of deep listening to community. I love the, community source solutions, especially with communities that have been on the front lines, of the struggle for public health and mental health too. So I want to invite those who are here in the audience. I know that many of you are likely watching this after the recording, but for those of you who are here, by all means, share your questions in the Q&A, and I will endeavor to get to them. But I want to first ask one more question of the panelists, and so by all means, write your questions, and in the meantime, so there seems to be a severe shortage of psychological help at every level across the country, particularly acute in remote districts here in the islands. So I know that Kaiser Hawaii therapists went on strike to protest overwork, and telemedicine has helped, but not sure if it's a complete answer. Roger Jelinek was talking about a recent Civil Beat story about a night patient who lost her Maui therapist and was suddenly switched to a Michigan therapist, sort of this outsourcing of therapy. And about the fact that simultaneously there are national radio commercials advertising help from thousands of therapists. So I wanted to ask you a little bit about what is the truth of this time in terms of resources, what we need, where there are shortages, and what can be done about them. And anyone jump in.
Dr. Jing, did you want to go? Yeah.
Yes, I was gonna say that I can speak from like a ground level working personnel. So this might be kind of like a message to people in the high ups who has role in like policy changes and stuff like that, to kind of I want to advocate for more mental health specialists to be what does it call, like reimbursed better in a sense, because like I think one of the things that kind of make people not want to go into into like therapist, psychiatrist, because the training is really long, and you have to take out debt or student loans, and then afterward you don't really make a lot of money. And I do see that there's a lot of youth and young people who really want to go into this field, but it just doesn't look like they can make a living realistically. And especially in Hawaii, I think there's not a lot of therapists, because we and Dr. Girl and Dr. Coffee, you can correct me if I'm wrong. I don't know if we have like a grad school here that produce like therapists to the community. Most of the local have to like go away, and then if they want to come back, they come back, but some may not coming back. And it's also hard to recruit people from the mainland or from other country to kind of work in Hawaii as well. So that might explain why there's such a shortage.
So we do have 2 graduate schools here, but what we do have a shortage of is those the internships and the postdocs. So they have to go away to get those done, and then they come back and get licensure. It is a long, long road to become credentialed to be a therapist. So you're so right. It's a great point, Dr. Jing. What I want to say about the folks that I work with, for the last 2 or 3 years, people were working 5, sometimes 6 days a week, sometimes 8, 10 hours a day. It was crazy. And it still is like that. I mean, we're working really long hours just to try to get everybody in. People have been creative in our group practice. We run about 4 or 5 different group therapies throughout the week. Now, I just want to sensitize folks to a continuum of care. So the beginning of care is like when you read articles in books. So it's just like self-education, or maybe talk story with friends. And then maybe you go to a teacher or maybe even a pastor or something. And then you go into a counselor or a mental health provider. There's a couple different levels. There's masters, there's PhD folks who do that talking therapy piece, but there's a whole bunch of work that people do on the front end. And I encourage people to continue to educate themselves as much as possible from credible sources. Then they go into counseling. And when counseling does not seem to be enough, that's when we have like Dr. Jing and Dr. Tony, because they have a higher level of intervention, like with medicines. That's what the MD in psychiatry is about. So there's kind of like, it's like a funnel. And I think that there's, at each point of the funnel, there's something that we can do to try to create capacity. But everybody's got a little bit piece of this puzzle. I just want to kind of sensitize folks to that. But I want to give Dr. Tony a chance to talk on this topic too.
Yeah, thanks. I mean, I think these are all great answers and perspectives. And, I think, both of you see on the ground what happens when there is not enough access to therapists and providers. I mean, the kids come in sicker and, they come in at points where you sort of wish that there had been other levels of intervention beforehand. I think if we look at actual numbers of at least psychiatrists relative to our population, there aren't enough numbers based on what have been recommended in national statistics. And, I really think that, workforce should be such a high priority for all of us in looking at what to build and, where to, invest resources. And I do think that, in the ideal world, there really should be, the development of a local pipeline that is accessible and that is really grounded in, what the needs of the communities are and what will give patients the most comfort in accessing care.
Thank you very much. So, I just want to just from the perspective of, a parent. Well, I'm a parent and a teacher, but can you speak in terms of in order to make us feel prepared in whatever our arena of engagement with children and teenagers, what really are the specific signs of childhood anxiety disordered anxiety, that parents and teachers and community members should be aware of? In other words, how do we then, effectively sort of intercept these early stages so that the anxiety perhaps doesn't expand into the teen years? You mentioned a couple of things like meditation, like mindfulness programs in schools. There's social emotional learning, there's family and community supports, right? And I've seen a number of effective examples of such programs, but, what are we looking for and how do we intercept so that the anxiety doesn't expand into the teen years or become more serious? What are some preventative and proactive techniques, please?
Yeah, I think your point about sensitizing people to what anxiety is and how it manifests itself is very important. I mean, we recommend that in primary care medical practices, there be some sort of screening for some of the more common mental health conditions. And, specifically the way anxiety could manifest, it could show up as, sleep difficulties. It could show up as, suboptimal school performance or even suboptimal school attendance, when kids are so anxious that, it's too overwhelming to leave home or to go into a school setting. I mean, I think if anxiety goes on long enough, I mean, it will show up as depression and other things that we commonly might associate with sadness, like, tearfulness and social withdrawal, lack of interest, and, even weight loss if it gets to a certain point. But yeah, I think that kids, because of their developmental stage, they may not necessarily manifest anxiety as the classic worry that adults have. Anxiety could be a very physical thing. They may, complain about a lot of stomach aches, a lot of headaches that lead to, school absences, or, excusing themselves from the class setting. There could be irritability and, shame and discomfort as a result. So yeah, I think that's an excellent point. That's something we all need to do to, take the step of being proactive and reaching out to kids.
Thank you. I guess we are going to be wrapping soon. So just, I guess just one more question, which is, what are the biggest stigma, would you say, from your experience surrounding adolescent mental health or childhood mental health? And similarly, what are the biggest misconceptions around youth anxiety that we can become aware of?
Well, the kids think that we're going to shrink them. So I just want anybody who's listening, a child, we're just people too. And it's a comfortable place to come and talk story. And we take a great pride in trying to help our patients feel comfortable in the setting. But I think they think that coming to see us is a form of weakness, when I think it is such courage to come in. It's courageous on the part of the child. And who's the real hero there is the parent that brings that child in, because that parent is also exposing themselves to whatever this stranger may say. So, it's a system, and the parents are heroes for bringing their kids in.
I also want to add that in the past, when there's not a lot of knowledge about mental health, there's like some scary scenes in the movies about certain kind of treatments that people think that, patients who go see psychiatrists or therapists are quote unquote crazy, but it's actually not that way. We do see, a range of illnesses from like depression, anxiety to like schizophrenia, hallucinations and things like that. So I would say my mom and my grandparents' generation, they associate psychiatry and therapy with that kind of like picture. So there's like a stigma that if you go see a professional, then you're crazy or you're not well. But now, like Dr. Tony was saying, it should be more, kind of like you go see eye doctor, or you go see dentists and things like that. Yeah, so I'm glad we talk about this, so that I think the things that lessen the stigma is the connection, and by having this forum, we bring everyone together to feel more connected and lessen the stigma about this.
Thank you. Thank you. Well, I'm going to wrap it up momentarily and ask Roger to close us out, but I want to thank each and every one of you for sharing your insights today. I know I learned a lot. And, my takeaways are that, we have to find that balance between reality and positivity and optimism. Of course, the world can be a scary place, but we can educate children, families, teachers, to help wrest control, and that if we're working together, that we can mitigate some of those external factors and teach self-reliance and inner peace, and lead children through practices of reflection and those strength-based approaches, and model how we want children to feel, and love them into wellness as well, and be brave, right? And so I know that as a parent, it was hard. I wanted to protect my daughters from everything that seemed dangerous, but that can also further isolate them from what is popular, or and they find ways around it anyway. And and so just thinking about screen time restrictions and other ways that we can encourage a sense of self-value, can also then exacerbate social anxiety. So it's just a complex a series of considerations, and you have helped us to understand this issue and topic with greater nuance. So thank you for your continued work and the efficacy of your interventions, and for your brilliance and your loving connection and contributions to our community. And Roger, I hand it back to you for closing.
Well, Maya, thank you so much. That was really a model panel, a combination of expertise and wisdom and common sense, and it's a hugely complicated subject, and you addressed it with directness and simplicity, and Maya, you were a wonderful moderator, thank you. And so attendees, I'm sure you got a lot out of this. It will be available, it's recorded, it will be available in the Better Tomorrow Speaker Series YouTube channel. And thank you again, everyone, very much. I have one final pitch, which is we very much intend and hope and intend to be in person next year. This exploring Zoom has been beneficial in many ways, but in many ways we absolutely miss the serendipity of impulsive joining in to things you'd never expected to see. That makes an in-person festival far superior to what we can do with Zoom. But so it takes a lot of funding to put on an in-person festival. So we have a fundraiser on January the 26th, and I'll be reminding everybody to put it in their calendar again and again and again between now and then. And again, thank you so much. It was really quite an experience. Aloha.
Thank you for having me. Bye.
Thank you.
Bye,
Thank
Dr.
you.
Jing. Thank you, Maya.
Bye.
Bye, Tony.
Bye. Thank you.